how do I say his name?
Sodani. I think we are live.
Hello and welcome to this webinar on careers and courses in healthcare management. Um, Healthcare management is a sort of exploded, I should say, in the last 20 years. Some of the data points we are seeing are truly stunning. We have claims that the job postings in this particular sector grows at around 5% month on month. We're not talking year on year, but month on month, the job postings are increasing, and the government has estimates that this year the healthcare industry in India will touch $50 billion. It'll be worth $50 billion. So it's not sunrise, it's noontime in healthcare industry, and there is a lot of interest. Many thousands of people have registered for this webinar, which is an indication of the interest in this sector. And we have very distinguished panelists to tell us all about this topic. We have Dr. Gaurav Takral. He's a doctor as well as an entrepreneur who made the transition to managing and entrepreneurship from being a doctor. So he's an industry man. He will tell us about the industry, what the state of the industry, and answer questions. We have another very distinguished panelist. He'll be joining us soon. He's one of the pioneers in healthcare management education, actually, Dr. Sodani. He is the president of IIHMR in Jaipur. Welcome, sir. So he's joined us. So we're ready to go.
Thank you. Yeah.
We're ready to go. I'll toss the floor. Sure. I'll toss the floor to Gaurav. Tell us about the state of the industry. I mean, so it's been there. It's sort of in this shape. It's grown into this shape in the last 20 years. Would you say that? And then what is now? What's coming? So give us a sense, and also career opportunities.
Sure. Thank you, Meenakshi. So I think I have been very fortunate to be part of this. I would say healthcare, but more so corporate and private sector healthcare in this country for the last 25 years plus years. And I was fortunate to join one of the biggest corporate chains, Fortis, when it had its flagship hospital, the first hospital, which was the first in North India in Mohali, Chandigarh, right? And till then, I would say the whole industry was centered around, number one, acute care, which is emergency care, right? And then the whole industry was focused only on hospitals, right? I've been with the hospitals for a decade, right? And then the whole transition of the nursing homes shaping up into tertiary care hospitals, right? That's how we saw the job of the primary healthcare, the job of the tier 2-3 cities, rural, was all put up to the, I would say, public health and the government settings, right? Which Dr. Sodani can talk more about, because his university is known to be one of the best to work in public healthcare sector. But after I saw my stint in the corporate sector, where the norm was very clear, that you need managers. Doctors were supposed to do their job, and they were supposed to treat patients, and then you need a whole spectrum of people in the hospital to manage the operations, to do the management, to manage people, right? But then, in almost now 13 years back, we pioneered in India what's called the home healthcare industry, or out of hospital industry, right? And from out of hospital industry to being at home, we further forayed into digital health, especially during COVID, when telemedicine became the norm. And finally, now we are the largest home healthcare company where we treat patients at home. We treat patients in transition care centers, which is a bridge between the hospital and the home care. And we also treat patients digitally, right? And that also, I think, the emerges branches which have come out of the hospital have been maternity like Cloud9, have been pediatrics like Rainbow. And what we are trying to now get into is physical medicine and rehab and geriatric care out of the hospital. Having said that, this was all about treating the patients. But then the whole industry about the insurance industry, which has grown so rapidly over the last 1 decade, needs a lot of people who are healthcare managers. There are industries like pharmaceuticals, industries like devices, all the new gen industries now, which is your health tech, your artificial intelligence generating industries. I think the whole push has come out of hospital, and now beyond treatment, what all can be done for healthcare, for longevity, and for livability. So that would be my response to you, Meenakshi.
Okay, what do you see coming? What is exciting? What are the new things besides AI? Of course, AI is everywhere.
What I see is again a lot of job opportunities, because, as I said, this is a very people intensive. It is not a product industry, right? In our organization, the biggest strength which we have is people. If I don't have people, I can't do anything, right? And people need managers, and that is what this course teaches you, that how to manage people. So that's my take, and I think healthcare is here to stay. It is here to boom, because the way the populations are increasing, the way aging is happening, the average of aging now is, we have in our own assisted living, we have around 70% patients who are above the age of 85 years, right? When I was getting trained in medicine, I hardly used to see patients above 75 years of age, right? So with
Right.
longevity, with aging, the healthcare is going to boom, and we need more and more people to manage people.
Okay. Well, it's interesting. We'll talk more about that. People management in healthcare. How different is it? How similar it is? Very interesting topics, of course. I now ask Dr. Sodani to tell us, sir, where did healthcare education, management education start? Where it is now? What's coming? How many courses? There seem to be 20 odd courses. I counted 25
Right.
courses. How many are there?
Yeah. Well, good evening, and it's a great and interesting topic for me, since the whole domain area of healthcare, and as we all know that the healthcare is the fastest growing sector in the Indian economy in terms of the revenue and the employment opportunities. Now, as far as the healthcare is concerned or management of healthcare is concerned, yes, there are prestigious courses which are available for the young generation. And we started all these programs long back in 95, 96, when it first kind of program in India on hospital and health management program at postgraduate level. And that program has become one of the flagship program in India. And we train around 250 hospital and health managers every year, and there are a large number of career opportunities for these young graduates. They go and join the corporate sectors as well as the health management institutions like government sector or government related organizations, international organizations, development partners working in the healthcare sector, and so forth and so on. As far as courses are concerned, yes, there are, means if we can divide the whole health sector, it means that it is hospital management courses, health management courses, public health related courses, as well as the pharmaceutical management related courses. So all these courses are, you can say, related to the healthcare environment only, and there are large number of career opportunities available in the market, even in India as well as outside or in other countries also. And this is all about the long-term courses, which are 2 years full-time program. After COVID-19, actually, we started some programs for the working executives also, those who are already working in any healthcare organization, and they cannot, leave their job at this stage. So for those candidates, we have conceptualized the executive education programs, and we now have the executive MPH program as well as executive MHA program. So these programs are also well received by the professionals who are already working either in the ministry or in the hospital or any healthcare organizations. and as a mid professional, they would like to enhance their leadership and management skill set. So these are the good courses. They can engage with these courses along with their working and professional life also. Apart from the 2 year program or long term program, we also have various short duration programs for the health sector professionals, like 1 week or 2 week programs. These programs will mainly focus on a particular thematic area, say, for example, leadership and strategic management in healthcare, monitoring and evaluation of health programs, public private partnership in the healthcare. Um, Mainly these programs uh, are attracted to those who are already working somewhere, either in the government institution or even in the private institutions. They come for the specific training needs that I would like to know more about monitoring and evaluation techniques and tools. The people already working or engaged in monitoring and evaluation, they come to enhance their skill set. Is there any latest or new technology or tools are available or not? So various, there is a huge variety of now courses are available as far as health management area is concerned. 2 years full-time programs, which are good for the fresh graduates. As I have already shared, there are MBA hospital and health management, MBA in pharmaceutical management, and we very recently, last year we also started a very new program, keeping in mind the industry requirement, the MBA healthcare analytics. Since now the digital health is upcoming very well, and as we all know, the government of India has a huge thrust on the digitalization of the healthcare sector, and definitely IHMR University, as we have long legacy of 40 years working in the health management, education, and research area. We also thought that let's working towards developing this area also, digital health, and therefore we have started a separate school in the university, that is the School of Digital Health. Under the School of Digital Health, we are now conceptualizing new programs for the young generation, and one of the first program in India, I think that is one of its kind program. Analytics. We have a lot of program in the management schools on the business analytics and all these things. But as far as the healthcare analytics is concerned, this is one of the only program in India, and it has been received very well by the young generation. So I think this year in 2025 we have the cohort two, second cohort will come in the program, and there are a huge potential for these students, like not only in the government or private sector, but they are also looking towards the startup and new technologies, how the technology can be utilized to improve the accessibility of the healthcare services, to improve the cost factor. It means that reducing the cost of care for the client as well as the providers. So the technology has a huge advantage. Like we can improve the efficiency of the healthcare sector utilizing the technology. Not only the private sector, nowadays the government sector is now very serious in utilizing the technology. Central government as well as all the state governments, now they are very keen that how we can use the AI or generative AI, or a lot of discussions are going on even in the government and ministry level. I go and talk to various senior bureaucrats and administrators, that they are now also very serious that how we can improve the, say for example, efficiency of a tertiary care hospital, and use patient load in the tertiary care hospital in the public sector. But how to manage all these things? So can technology help in even, like, say for example, managing the crowd? How to manage the crowd in the hospital? A lot of people are coming to the tertiary care hospital, and how we can optimize the time for the patient. Patient should come and enter into the hospital if they have the appointment with the doctor. So all these things are now going on very well, and I hope that the next 10 years, that is for the digital health only. More and more people will join us, know more about the digital technologies, analytics, predictive analysis, and many more things are coming. And by that, we can improve the efficiency of our systems. If we talk about health systems, there are a lot of issues where we can improve the efficiency. This is all about from my side, and if there is any question, I would be happy to answer the questions of the participant.
Thank you, sir. Thank you for your opening remarks. So, so typically there's an MBA and then there are many other programs. And
Right.
I, we do see executive MBA programs for full-time working professionals. I suppose it's online, hybrid, sometimes
Yeah.
mixed. So that's also, and you're saying your institute does it. I saw that IM is as advertised. I am lucky. So are these courses available across India, or are there select institutes? Are only a few institutions specializing in
Uh,
this?
yeah, actually, our courses are available across India. Yeah, our MBA programs attract, students from all over India. Like we represent 27 states from India. Our student diversity is so huge. So it's a very fantastic, you can say learning environment here that the student come from various states, like around 25, 27 states. They come into one class. So there is a huge means cultural differences are there, but still they learn a lot of things since they are coming from various states. So whenever we teach in the class, we give a lot of examples, a lot of case studies related to various states. So they learn from, even from the peer groups also. There is a huge learning if you have the diversity among the students.
Okay. In terms of, so we talked about some of the segments, pharmaceutical,
Yeah,
and Gaurav talked about, aging population, which brings
correct.
to, yes, which brings us to an interesting thing. There are very different, India's several regions, several states, and there are very distinct aspects to healthcare, if you look at
Right.
India. So are there any regional differences? I mean, for instance, the southern states, the TFR has dropped, so the population has certainly started aging already. I believe by 2030, post 2030, even Tamil Nadu, much of the population is going to be much older. So, I mean, that's one area. Do you think there are regional differences, like where the north is this and the east, northeast? Are there such differences
So
in terms of the
I'll take,
industry?
yeah, I'll take that. You're absolutely bang on that. We are seeing an industrial change happening due to aging. This whole industry of senior healthcare, right? Whether it is whether it is a acute emergency critical care surgical hospital for the elderly called geri care, or whether there are places which are independent senior care livings or assisted livings like us, Atulya, and many more, right, which are absolutely cropping up more in Hyderabad, Bangalore, Coimbatore, Chennai, right? And actually you would be well aware of. And still we see that in the northern part of the country, and for that matter in the eastern part of the country also, this concept is still not gaining that. Similarly, this whole industry of elderly wearables, fall protection, right? All this because of the aging population, because of the uh, I would say the literacy levels of the population, because of many people or the children living abroad, right? There are many new these people have become very very new technological savvy with digital health, as Sudani sir mentioned, right? Which is actually showing that the shift of all these things is happening first in south and then percolating to other parts of the country. That's the
Right.
visibility I have.
Okay. What does a healthcare manager do for a student who's considering this? We've had several. Those who registered had so many questions. They were asking, "Can I do it? I'm a biotechnology student. Can I do it? I'm just a BSc Science student. Can I do it? Who can enter the stream?" And then,
Yeah.
when he does an MBA, what does he do?
Yes, as far as healthcare managers are concerned, since when we designed or conceptualized these programs, we had a lot of brainstorming with the industry people, academia, and many more people, and we found that for a manager to serve the healthcare sector, basically he should be trained in the management tools and techniques. Sector may be any sector, either it can be the agriculture sector or the healthcare sector or the hospitality sector, whatever it is. But the key component should be that he should be well versed with the management tools and techniques. I think that is the fundamental, thing behind conceptualizing all these programs. So in our university, whenever the student comes for the MBA Hospital Health Management, MBA Pharma Management, or even MBA Healthcare Analytics, we take graduate from any discipline. Graduate from any discipline. Either it may be a commerce graduate, a arts graduate, a medical graduate, a dental graduate, or a physiotherapist, or even engineers also sometimes come for our course. And so it's that gives also a lot of interesting when the student comes into the class with a different background, and then they together learn how to manage the hospital or healthcare sector. So that gives a lot of opportunities for us to enhance their learning environment. And
Can I introduce it? Can I interrupt? So you
yes,
don't
yes,
need a
yes.
science background to do this. Can
No,
commerce? Oh, really?
no, no. In our university, even the science background or commerce background, whatever I am trying to say is that the background doesn't matter. We train here.
Huh.
When he spent 2 years with us, he's a full manager. The basic skill
Okay.
set which required for the management is that he has to learn about leadership. He has to learn about various management functions like finance, economics, marketing. All these things he can learn here. Either he comes from a science background or he comes from a any other background, but he has to learn. So he should be very open for the learning. And there is a good platform they can learn. And one more thing, that it is not like our teaching is not the classroom teaching. When the students are here, they go to the field, they go to the hospital, they see the live things there, and then come back to the class, make the presentation, and then the facilitator or the faculty they help or facilitate their learning environment. So the student goes to the public healthcare sector environment also, say for example a district hospital. Their challenges and their problems are slightly different than a corporate sector hospital. So the student are given the opportunity that you see from your own eyes how the health systems is working in India. Either it is a public sector, or it is a private sector institution, or it is a run by the government in the rural area, or even in the urban slums. So they get a lot of opportunities, and then there is a group work exercise, case study exercises, and therefore they come up and make their own presentations, and that facilitate their learning very well.
That was an eye opener. So you don't need any domain expertise to enter this field. You don't even
No,
need a science
basically,
background.
a graduate student come here to create his own domain. That is the healthcare sector domain. So, and then he becomes the specialist in managing the hospital. Even I would like to, narrate here that when the student opt for the hospital management in our program, or they can also opt the health management as a specialization. Students who have opted hospital management here, they went for the placement in the hospital environment. And say for example, during the hospital service, as a manager, he created his own strength in the quality or accreditation type of things in 5 to 6 years. Then there is a lot of opportunities for that student. It is not essential that for the lifelong he will remain only in the hospital environment. He can jump to the government sector also. Government also requires the people who know how to improve the quality and accreditation for the government institution. So there are many of our alumni, they have shifted from the hospital environment to the public health environment. The major thing is that they know the competencies. They are well aware about the, say for example, a person is moving in the monitoring and evaluation, type of area within the health sector. They can move anywhere. Either it is a international agency. Many of the students are working in the WHO, World Bank, UN agency. They have the expertise of M&D type of activities. There are many students who have the strength in the quality and accreditation. They go to the corporate hospital. Even they can go and serve to the government institutions also. So there are a lot of opportunities available in the market. Many students go to the consulting also. Nowadays, it is a new area of opportunities for our students. Many of the consultings now they have entered into the healthcare environment, healthcare sector, and they require within their team they require the person who has the healthcare sector domain area. So they have the other team members, but our student they require, because he is well aware about the hospital healthcare environment and he can contribute very well in the project design or the consultancy projects or even in the research area also.
Okay. Gaurav, you're a doctor and then you became a manager. I'm sure many doctors we saw, for instance, in Chennai, there was a time when doctors started setting up these really big hospitals, and they're still functioning. They're big institutions today. Um, so you are one such person. You didn't do a management degree? You didn't do an MBA, I suppose. Now, but
Yes.
has it become very specialized? How, like, some doctors still want to consider, they want, what kind of entrepreneurial skills should they
Right.
add to their skill set? So what sort of
Hmm.
courses should they do?
So
What does a
Meenakshi, first,
healthcare manager do? First tell us, what does a
yes.
healthcare manager do?
Yes. So I'd like to add to what Sudani sir said. I have been very privileged to visit his university, HMR Delhi, Jamia. I worked as visiting faculty also. Know a lot of alumni. Many alumni have worked for me also. And I actually say that people are not aware that non-medical personnel can also do this MBA. And hence
Right.
I'm repeating this message. Although still, as per my observation, not more than 5% people are from commercial arts. Mostly people are dental, and then see a bunch of doctors, nurses, therapists, and all. Right. So I think that message I would want to give to the audience, that this is an extremely rewarding uh, field for all non-medical people also. Now, what does a healthcare manager do? So first of all, the domain healthcare itself is very interesting. I met somebody today, and this person says कि in healthcare आप सेवा भी करते हो और मेवा भी मिलता है. And this thing I tell to all the people, that this is the only job where you earn also and you get blessings also. So it is very, very specialized in that term. So that's about healthcare. We all are blessed that we are working in healthcare. We all are blessed that we save lives, we change lives, and we make a very significant change. So that's a very respected thing. Now, what does a manager do? Before going into, I'm splitting the word healthcare and manager. A manager is somebody who manages, but who are you supposed to manage? I think the most important thing is to manage the people. So you have to learn the skills of managing people. It's a very simple example. A
Hmm.
surgeon, whenever you go for a surgery, you ask, from which surgeon do I go to, right? You never ask who's going to be the OT technician, who's going to be the scrub nurse, who's going to be the biomedical engineer of that OT, who's going to be the AC technician of that OT. We assume that this manager, who's a surgeon, will take care of all these people so that they will do their work right, and then the surgery will happen to the best of the expertise. Also, I believe that a manager is somebody who grows people in his team, right? And vacates his position for his team so that he can grow up. So as a manager, I think the biggest thing which you do is management. And uh, with all due respect to all these courses which are happening, I'm taking the liberty of saying this in front of Dr. Sudani itself, who's, I think, one of the premier most institution. These students which are coming out these days, they feel that they are born managers, which doesn't happen in other MBA streams, right? So what I'm saying is that the sky is the limit, but you need to learn the trick of the art. You need to learn the ropes of the trade by first learning yourself when you are coming into a practical environment. The ownership which you get once you get into a job is very different once you are doing an industry inspection or you're doing. And I believe that people who have the right intent, to learn, right, they become fantastic managers. Today, the CEOs of the best of the hospitals in the country, who are not even doctors, have done their MBA healthcare, are doing a fantastic job, and many of them are known to me. And that's how I will say that a healthcare manager is somebody who knows how to take the blessings of the patients by giving a team which is delivering the best, but also knows all the tools and techniques which are taught, and knows his numbers very right. Because at the end of the day, the sector from where I come, or from the sector which is government sector, at the end of the day, all analytics speaks numbers. So you have to be very good at your numbers, very good at your P&L sheets and everything to become an actual manager. Because when numbers drive your decisions, it is logical, and then everybody listens to you, and that brings productivity. And productivity is what is required in healthcare or any industry. So, I hope I was able to answer your question. It was a bit long,
Sure,
but I
sure.
was.
Yeah. Can I add to this one?
Please,
Yes,
please.
sir. You're
Yeah,
welcome.
yeah.
Most welcome.
Since it is very interesting question that you raised, that what the healthcare managers do basically. You know, healthcare manager do a lot of, there are a lot of scope, lot of opportunities for the healthcare managers, like various, when we say management or the managerial skills, it is not only one skill set, or there is a multiple skill set that requires. Say for example, supply chain management, that is also a hospital manager or health manager's job. Quality management and accreditation of the hospital and healthcare institutions. Patient safety, patient care, that is another area. Monitoring and evaluation of the various programs, and also the performance of the hospital. So monitoring the performance of the hospital on various indicators. So there are a lot of hospital indicators through which we can measure the hospital's performance, and the hospital manager usually are engaged in such type of activities. And very interesting that our colleague just shared that the managing the human resource, that is also very important and fundamental for the hospital manager or the healthcare manager, that has to manage the human resources available in the organization. They are also basically they can also support the branding as well as the marketing or sales of the hospital. But nowadays, since analytics play a lot of role, so what we engage our student in a lot of analytical techniques also, so that they can sit with the hospital data set, big data is available of the patient, and then they can do some analytics out of that and come up with some inferences that what's the trend which is coming, what type of disease profile the people are coming, and what type of characteristics the people or patients have with this data with this disease profile or like that. So through that also, the hospital authorities, they can have a brainstorming session among themselves. Even the hospital managers can also contribute in price determination of the various hospital services. Very, very important, very fundamental for the managers to decide on the pricing. What is the appropriate pricing in the competitive market? There are a lot of hospitals, they are conducting a lot of various types of surgeries. Now, how to decide the pricing for our hospital, so that it could be beneficial for the hospital, as well as you can say that you can attract the good clients also to the hospital. So I think there is a large list to do for the hospital managers. Yes, sir.
So just to add what Sir said, if you have heard Sir very clearly, he spoke again and again about hospital managers. What I just want to stress is, as healthcare managers, you can take all these expertise which Sir mentioned beyond the hospitals, whether it is home healthcare, whether it is primary
Yeah.
health, whether it is insurance, whether it is medical
Yeah.
devices, whether it is now,
Mm.
as I said, telemedicine, health tech, on and all these places which I am speaking, because that's my domain expertise, are still not that crowded. And the
Right.
growth is very, very high in all these sectors, because these are all new gen things, and they are also growing, right? I worked in Fortis when Fortis was one hospital. In 6 years, I was able to become a head of a hospital, because Fortis exploded to 70 hospitals, right? If you don't foray out of your comfort zone, which I say hospital is a comfort zone, then the growth gets stalled at some level. So all these things can be put into practice, what Sudhani sir said, in out of hospital care, in health tech, and many more things, and will give you exponential growth. So that is the point I wanted to make.
Yeah,
The
yeah.
universe is huge.
And apart from the hospital, when we say hospital, even the health insurance is also coming into this. So there is a lot of opportunities for the claim management, say for example, and there is a manpower, a dedicated manpower is required for this also, and he sits in the hospital or with the TPA or with the health insurance agencies. Now, I think we all know about the Ayushman Bharat, and a lot of new areas which the government of India has already opened. So I think huge opportunities exist for the insurance and Ayushman Bharat type of initiatives, and National Health Authority is also there. They are working on the digital health environment. So there is a huge stuff for the young generation to be engaged in the healthcare environment and health sector.
Okay. Gaurav, very important point you said. So the whole healthcare field is diversifying,
Yeah.
and you brought out many, many areas into which it is diversifying and which inevitably would need to be managed, and you need managers to do that. Point taken. The MBA is, we had a webinar some time back about the online hybrid version. So the MBA is a sort of a state of mind. So the manager is somebody who solves a problem. He gets that state of mind to solve a problem, whether it's in an engineering company or a company that does rocket science or or media or even healthcare, I suppose. So that manager, when he gets into healthcare, are there specificities? Like, is there anything unique and specific to healthcare that he should be aware of? For instance, we had a talk about this some time back. So you are entering a field where there's a lot of domain expertise, and
Hmm.
people have a certain, both doctors, nurses, even assistants, there's a certain level of, as you said, you get seva as well as meva. So you serve and also get money. So it's a lucrative career. You made that point. But so these are professions that have like a higher calling. There's a higher thing that they are doing. Doctors have that sense. I mean, however corporate they are, but there is always the sense that they are serving. That's the first thing. And you are managing these people who serve and who have this big I won't say egos, but certainly professional pride and so on. So how do you deal with such a specialized and obviously very qualified and capable people? What do managers need to do in that
Very interesting. Very interesting, sir. I think I'll take it first from the side of the provider again. So you asked me how did I become a manager, right? I was also a self-contributing doctor, but I said during our medical school itself or during our emergency management, we all know that we manage, right? So doctors, I think inherently they are told how to manage because they have to manage teams. They can't work independently. But when I was 2 years old into the Fortis system, my chief operating officer called me and asked him, I think you have a knack for administration, you should get into administration. And I said, no, sir. I have devoted 11 years to my medical education. I'm happy treating patients. But I think that was a time when, as you said, and you rightly said, doctors with professional prides interpreted as egos, or how to handle this whole nursing crowd who's actually very very hardworking, and still they have to bear the brunt of everything. And then this whole divide between the MBAs of that time and the doctors, where the doctors would say, "Your MBA, what do you even understand of doctory?" Right? Or MBA would say, "What do you understand of profits and then things?" This was actually a very big problem. I think that is what propelled these big chains in hospitals to get doctors to become managers, so that this whole sense that I don't know your domain happened. But that is, you don't have as many doctors as you need managers, right? And I tell everybody in my organization that if you are working in a healthcare company, you cannot say that I don't know healthcare. You have to learn it, and you have to learn by doing it. I still remember early Fortis days when CABGs used to happen in North India. Not as because Delhi and Chennai were the, well, we used to get non-medical people, even medical people, to see how a cardiac surgery is happening, right? Because till you don't know how critical that situation is or how complicated it is. So the point I'm trying to make is, in healthcare you can't say I am not a doctor, I am not a nurse, I am not a medical person, and I don't know what you do. If you need to manage such people, you need to know them, you need to understand them, and you need to be on their side, and you will be a very successful manager. That's my own personal experience which I'm sharing.
Dr. Sarani? What do you tell your students? They're going to be managing
So,
very talented, capable people with lots of professional pride slash egos. What do you tell your students?
we say our student that whenever you go to the hospital, please try to be more, two, three things, they should be patience, and they should learn every day, means from their practice, from the working with various colleagues, and also try to improve the operations and efficiency of the hospital or healthcare environment. They should be very open, the learning, it's not like that they have completed the course and now they are fully trained or they become the manager or the leader, but it's the everyday affair. So every day if they contribute or learn something new, that should be inculcated, uh, again, ready to try to use that skill set in the same environment.
Okay. Now,
I'd
as for the
like to add
courses,
one thing. I'd
yes,
like
yes,
to
yes,
add one
Gaurav,
thing. Yeah,
go
I'd
ahead.
like to add one thing. You said that how do you manage such talented pool of people? Very, very interesting again, right? You can manage very easily if you are logical. One thing which
Yeah,
happens after such courses, and I won't blame this, when you get this sense of entitlement that I am a manager and now you have to listen to me, that is where you start losing. When you
right.
if you are logical, a highly talented and intellectual people person will cannot defy logic. That person will actually become embarrassed that why I am not able to understand a logic which this person is able to. So I think what is the whole transition is, don't get entitled with the title which is coming with this degree, but be very logical when we are talking to highly talented and intellectual people, and that sorts everything.
Yeah, yeah. Here again, I would like to add one more thing, that we also stress to our student that don't jump on the decisions. Decisions should be made based on data, some evidence, and
Yes.
then if you have some data, then you analyze it and then properly put it to your seniors that whatever you are saying, it is based on trend or the data which you have analyzed. It is not like that without the data, without the evidence, you are making some judgment. That is more subjective. It may be subjective, but maybe you should be more objective towards your decision making. So sharpen your decision making skills with the lot of tools, lot of techniques you have in the management discipline.
Absolutely, sir. I'll give an example of this if I have time. Do I have time? I'll
Hmm.
just give an
Go
example of
ahead.
what's this.
Go
So
ahead.
I was a young manager. This was 20 years back, and I was the quality spoke of the hospital. I was managing quality accreditation and emergency department, right? And
Right,
one of the data sets or the audits which we did was that the people who are coming with the cardiac arrest or myocardial infarction or heart attack, in simple language, right? They were getting the best treatment at the emergency, right? And then they were getting the best treatment in the cath lab, and then they were getting the best treatment in the cardiac ICU. Now, when I did an audit, what I saw was that during the transition from emergency to cath lab to ward, there were three medicines which were getting missed in many people, right? And my cardiologist was like a stalwart, right? I used to respect him. I could not have gone and told him, sir, see your team, they are not giving proper medications. I just went with this data. It was an eye opener for him also, because in so many things you tend to miss things. And he told me only, Gaurav, you devise a process on this so that this doesn't get missed. And thank you for telling me, because at the end of the day, you are enhancing my capability. So now people ask me, you were such a young doctor. How did you have the guts to talk such as cardiologist? And exactly what Dr. Sudani said, I had data. So I just went with data, and he was logical enough to understand where the problem is.
yes, yes. Thank you.
Okay. So let's walk back a little, and I'll put this question to Dr. Sodani. What do you teach these students? There's increasingly a stress on numbers, analytics, and so on. But what are the core courses, like in any MBA healthcare management? What are the core courses?
So actually, our courses are like designed. Say for example, first we give some courses, core courses of the health systems environment. Say for example, healthcare delivery system in India, health policy, epidemiology, demography, biostatistics, uh, data management. So these are the core courses, and then we also give core courses of the management functions. Say for example, economics, marketing, finance, communication, so all these things are also there. Then when they come to the second year, then they can opt either the hospital management or the health management. Again, there are courses related to quality and accreditation, patient safety, applied epidemiology, applied demography, monitoring and evaluation, program management, that is very important program, that is important course. Similarly, health economics and financing, that is another area where we also trained our students, since a lot of initiatives are coming on health financing and government efforts are also there. So these are the core courses, you can say, either it is hospital management or health management, or even in the pharmaceutical management also, like I have shared the health systems environment. Similarly, there are few courses on pharmaceutical environment, and then management related courses, and then analytic related courses. For healthcare analytics, we have some more core courses which are related to the analytics. Say, for example, big data analytics, ML, AI, predictive analytics, and all these things are also there.
But and all these specializations are available to all students.
Yes, yes. Means that if we talk about particularly, say, for example, MBA hospital and health management, then there are two specializations which are available to the students, either hospital management or health management. So the first year of the MBA program will remain common for both the students. The second year, they have to opt hospital management or health management. So then they divide into two separate classes.
And so,
So,
just to
so
repeat,
the hospital management student, they have hospital related, modules. Say, for example, hospital planning, hospital accreditation. And, but for the health management student, they have courses like program management, implementation, monitoring and evaluation. Such type of courses are there for those courses. And there is a separate program, that is MBA in healthcare analytics. There also we have conceptualized that some health system related programs, since they have to work in the health system, then some management related program, and in the second year the whole focus is on the analytics.
so someone who's strong on numbers, commerce students, they may
Yeah,
find this
they can, they may find to the healthcare analytics very well. Yeah.
right. They may find it a more natural fit. But it's up to the students.
Natural.
There's really no bar on anyone doing
No,
any
no,
stream.
it's up to the student that what he wants to be
Okay.
there in the future. Yeah.
Okay. All right. So
Since
let's
students interest is very important, these are all related programs, related courses, but as far as what they feel that where they are comfortable, they should
right.
make their career in those disciplines.
Right. Yeah, because we do get during registration, we ask the question, what do you expect to gain? So there are people who are saying, okay, I'm doing pharma, I'm doing biotechnology. What is available for me in healthcare? But you're saying everybody's on the same footing. Everybody can do whatever they want
Yes,
to do.
yes.
Where did
Even
we
in
come?
our MBA hospital health management program, the students come from biotechnology background also, that they have the degree in biotechnology. They are shifting to the hospital management. Similarly, BDS, dentist, a lot of people are coming to the hospital management, health management. Similarly, the physiotherapist. So they are also coming to this area that they can be a better manager in the hospital management environment or healthcare management environment. Now, when we started the analytics, many of the students with the mathematics background or such background, they are coming to the analytics, since it is
Right.
good for them to learn the analytics easily.
Right. Okay. Let's discuss something very bread and butter. What are the salaries? Somebody who's passing
Yes,
out of an MBA from one of these.
salaries, yes, means even in the healthcare sector, we cannot compare with the business sector, but still I'm proud to share that the last our highest salary package is around 35 36 LPA means per year, and the students
Starting
are
salary.
placed in Africa. Yeah, the hospitals from Africa, they are coming to IHMR Jaipur for placement. Many hospitals from UAE, Dubai, Abu Dhabi, they are coming for the placement in IHMR. So students are getting good opportunities in very good organizations, and nowadays the market is also slightly very good openings are there as far as the salary is concerned, package is concerned. So the healthcare institutions are now also paying good or handsome amount to the fresh graduates.
Okay. So this it is pretty lucrative from what you say,
Yes, yes, yes.
but there is also a
And
saver, right?
what I see in the coming years, there is a huge trained manpower is required even in the public sector also. Nowadays, lot of government, lot of private institutions are coming. Private hospitals, they have already felt this, that they require the manager in various departments and all these things. But now
Right.
you see, if we see the government's norms or government standards for various district hospital or community health centers, and these norms are known as IPHS, Indian Public Health Standards. In the Indian Public Health Standards, they have mentioned that even at a CSC level, which is a 30 bedded community health center, 30 bedded hospital, you can say. There they require a hospital manager to manage the 30 bedded hospital. Now, can you imagine how many CSCs are there in India? In thousands, and everywhere still it is not open so far, means the openings have not come. But I think in the near future, when the government is ready to take such professionals, uh, things will totally move around. Even in our national health policy 2017, the government has clearly prescribed that they require the trained management graduates to manage the healthcare sector. So things will move, and even now the state governments are thinking about to create a management cadre in the health sector. As such, there is no management cadre in the health sector right now. But now they are thinking that why not we should have a management cadres, like the freshers can join at the district level program manager, then they go to the state level, and like that. So if a person becomes the directorate of public health, he should be a management graduate rather than a clinical person. So now the thinking is towards that direction. Why not? Even we see the government services, the people are not trained in the management, but they are managing everything. So they don't have the formal qualification in the management or administration, but still they are managing all the things. So now the government has also recognized that if we take the trained people, even means I have a discussion with the state level authorities. Now they are saying that we at least we can put a manager in the tertiary care hospital. Say for example, there are 100 tertiary care hospitals in the state of Rajasthan. Now they are thinking that why not we should hire hospital managers for every hospital, and that will improve the patient satisfaction, patient welfare, and everything that will add on to the hospital efficiency and hospital performance. Doctors should
Interesting
be,
point.
a clinical person should stress or emphasize on the clinical services rather than the administrative or the management area. If
Management
the
area.
managers are there, even the doctors or clinical person will perform in a better way, since then they can concentrate on the clinical services only.
Interesting point that the specialization that we saw in the private sector is seeping into the gov. It's already happening. You're saying, of course,
Yeah,
in the West or advanced countries, public health is a very and public health management is a very defined
very
field.
defined.
Yes, yeah, and you see that happening in India also. So the government sector is also going to employ healthcare
Yeah.
managers. Okay. So there was one somebody who had registered wanted to know if he can study MBA in healthcare managers here and work in I don't know in the US. I suppose. Are there job opportunities abroad if you study here?
In here, for our MBA healthcare or hospital management program, we do not require any experience. We require a graduate with 50% marks.
No, I said work opportunities abroad. Like for
Yes,
instance,
yes. Yes,
accountants,
I have already shared.
accountants
There are,
here, certified accountants here can work.
no,
You
no,
know,
they can work. Even our alumni are right now working globally, and they are working in US, Canada, many other countries, African countries, UAE, everywhere our alumni are working, and they are with this degree of IHMR only. So there is no issue basically.
okay. So not just IHMR, but perhaps other institutions.
Everywhere, since you have the proper degree, I think that is valued everywhere, not an issue here.
Okay. Indian healthcare management programs can get you
Yeah.
jobs abroad also. Okay.
Yes, yes,
All
sir.
right.
Like our around 150 of our alumni, they are working in UAE in various
Okay.
hospitals.
Mhm.
And last year only we had a placement in African hospitals. This year also African hospital came to Jaipur for the placement. So there is a huge opportunities, you know.
Okay. So we had a question, Srishti. She was asking a question. Can we? Yes. Do we need 2 years of work experience in healthcare facilities for him? Yeah. How much? Yes. This is a question. For any MBA program, it's always advisable that you get some exposure, some experience. So should they go and work in a hospital before
No, no.
doing it?
Actually, what I am again repeating that for our MBA Hospital Health Management program, experience is not required. What we require is the graduation in any discipline with 50% marks. But for our executive education program, which is executive MPH and executive MHA, there we require at least 3 years experience in the healthcare facility or anywhere in the healthcare sector. Since that is
Okay.
the program for the executives, working professionals.
Okay. That seems to be, since you're a trendsetter, that well be the norm in other institutions also, but Srishti may better check out other institutions. Do they
But
require,
the
but
students
government,
they
what?
get yes, the students they get a lot of opportunities during the MBA program to visit the healthcare facilities,
Right.
to do some assignment there, and all these things. So they get a lot of opportunities to see the facilities and hospitals and all these
So
things.
not any,
Right.
and I also don't know of any institute in the country where you need a prior experience to do healthcare management
Yeah,
MBA.
yeah,
But
yeah,
would you recommend it as an
I would
industry
recommend it.
person?
I would definitely recommend it. I
Okay.
would, I would definitely. I have recommended it. I'm on the board of IHMR Delhi. I've recommended to them also, to TESS also, because these are wonderful. So what happens is these are absolutely wonderful institutes, but the maturity, right? The maturity level of the people who are coming out, right, because of the lack of exposure, makes a little dent. So I would definitely recommend that this should happen.
yeah.
Okay. There's a comment that
But
by the
the but
time
if
you,
the if a person with the experience comes in our program, yes, he gets added advantage. Definitely, it is right.
okay. So it may be a good idea to
Yes,
spend some time.
exactly. I agree to sir. Whenever I have picked up students from all these colleges, I have already considered that this person should have a prior experience of working in a healthcare
Correct, correct.
facility, right? And these people who have prior experience and then they do their MBA, they get paid much better than the freshers.
Much better. Yeah,
That's also a reality. Yeah.
sure, sure.
Hmm. Okay. There was a slightly off tangent comment, but maybe relevant that doctors who are already in their 30s by the time they're specialized settling down. So it may well be that they may not want to do another MBA and then do a little bit of a career change. So that means more opportunities for, and so it's going to get segmented, specialized, very clear demarcations. It's not that every hospital will be headed by a doctor. We're already seeing that the big institutions are not being headed by doctors; they are healthcare management professionals. That's where things are going. Just a little crystal ball, if you can gaze into and tell us what's coming, sir. Dr. Sorani, what's coming? What's coming in healthcare management education? You said you recently introduced the analytics program. What else is coming? What else is coming?
So healthcare analytics again, I have already shared that the Ayushman Bharat or digital health mission also. There are a lot of initiatives which are going on. So market is full of opportunities for the students. Even the government hospital, private corporate hospitals, everybody is looking towards the analytics area more seriously now. Even after COVID-19, the people are more serious about the analytics environment. So, and using the technology, how they can better uh, deliver the services.
Okay, we have a series of questions coming up towards the end of the webinar. I think we should take them. They're interesting questions which some have missed. Somebody was asking what are the entrance exams? Um,
Uh, yes, we
yeah,
have the
Priyanka,
entrance
I
exam
believe.
for MBA. MBA entrance exam is there. Apart from the graduate with 50% marks, the candidate is required either CATE, MATE, or any other national level aptitude test for the MBA programs. If they do not have these types of test scores, then we also provide an opportunity from IHMR University to have the IHMR University's UMAT. So they have to, but they have to clear that MAT examination either from the national level or from the IHMR University, and that is also one of the requirement at the time of the personal interview or group discussion. So graduation marks plus MAT score plus group discussion plus personal interview. So all these
That's
things becomes the criteria for selecting the candidate.
that's probably typical of any institution, I suppose. They would go for
Yes,
the
yes. For any
man
institution, it is required.
like.
Yeah,
I hope that answers your question, Bianca. Srishti has a follow-up question. She's asking, okay, so 3 years of postgraduate training count as work experience for executive MBA. I don't
yeah.
understand the question. I don't know.
Uh, yes.
Does
Three
it, Dr.
years
Sudhani?
postgraduate. Sorry.
If somebody is doing their MD and they after their MD immediately, if they want to do executive MBA, is that an eligibility for the three
No, no,
years
no.
only?
Work
No, it's
experience. We
not.
require work
Yeah,
experience.
we need work
Yes.
experience after that. Yes.
Work experience of the 3 years. Yes.
But let me tell Srishti a very good thing to you, that people who have done their MDs and after that exposure in a hospital, whether private or public, they have done their MBAs. After that, they become rare entities. Right? MD
Yes.
doing MBAs, they become rare entities. You are catapult to the best of the healthcare institutions and the best of the
Correct.
positions, right? But then
Sure,
that
sure.
is a very, very conscious call. Like I took that, I did my MD, I practiced, and then I became a manager, right? Because that was a very conscious call, right? So don't worry, if doctors are investing their time and money into studying, that always helps when you are a manager or an entrepreneur.
Okay. Okay, it's another fundamental question. Anand Kumar is asking, please define the working model of a healthcare management person in hospital. I don't quite get what he's saying. What he?
Should I take this?
Who's?
Working.
Yes, yes,
Hmm.
yes.
So
Gaurav.
largely, how hospitals have worked is that whenever the people they come into the hospitals during the industrial trainings and all, they work as interns, and largely these interns work into operations or quality, right? So the entry level jobs of these people are like either they support the managers in, as Dr. Sudani said, in various data collation, analysis, and giving inputs for decisions, or they work as floor managers, as patient care coordinators, at those levels, and then they start growing up the ranks. A typical day would be again starting your job with your morning meeting with your manager, understanding what were the issues of the last day, and then what are the things or the indicators are behaving, what is the task for today, but most importantly, solving problems for the patients in a very empathetic manner, right? Not in a transactional manner, because that is what is going to teach you actually how to deal with patients, which many people have not done because of the lack of exposure before that.
Yeah.
Okay, I think we've completely run out of time. We need to close now, but very interesting discussion. Seva with Meva, as Gaurav said, you serve and also get money, and you also get paid for the service you do. But the intent is service, so you shouldn't lose that. And then we talked about the courses. What do the courses teach? What are the requirements, prerequisites? Important point that anybody can do these courses. You don't have to even have a
Right.
science background. You need to be a graduate. That's very interesting. And can doctors do it? Yes, a doctor and an MD with an MBA is top of the world, I suppose, top class. That's what Gaurav is saying. And money we saw, and what are the emerging courses? Real big push on analytics, data oriented decisions. That, as it has happened everywhere in other industries, also it's happening in healthcare, and there will be a big push in the public health system. There will managers, not just today only doctors do it. Doctors are the directors of management services, in state level. So very soon we'll be seeing specialized management cadre
Yes.
being created
Yes.
within
Yes.
the government. Dr.
Right.
Suran is very emphatic on that. Okay. On
Yeah.
that
Yeah.
note, we'll end this webinar. Very interesting, very insightful, and I hope it was useful. It will be useful. This is live on YouTube. Do write to us your feedback, suggestions. You can email us at education at thehindu.co.in. I repeat, it's education at thehindu.co.in. We welcome your suggestions. Thank you very much.
Thank you.
Thank
Thank you.
you.
Thank you,
Thank you so
Sudarshan.
much. Good interaction.
Yeah, thank you, sir.
Very interactive session.